Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be addressing physician depression, burnout, and suicide. It can be easy to forget that medical professionals are vulnerable to stress and even physical and mental health issues. Though we expect them to be well, physicians have a relatively high rate of depression. Physician suicide is twice the rate of the general population. In this episode, I'll argue that doctors have biochemical and environmental factors contributing to both their strengths and vulnerabilities. Though I'll focus on physicians, much of what I'll discuss applies to other medical professionals and caregivers. In this episode, I'll address the higher rates of depression and suicide in physicians, how undermethylation is likely a strong contributing factor, how early family dynamics may be at play, the medical culture that leaves physicians unsupported and reluctant to seek help, and I'll discuss some possible solutions. Because my own health issues forced me to change the way I worked and lived, I've buffered myself from a lot of the stress many of my colleagues experience and that I'll talk about here. To start with the data, unless you're a medical professional, the data might surprise you. One meta-analysis estimated a depression rate among medical residents at 29%, while the rate among non-physicians was 8%. One survey found that on average, 10% of physicians have had thoughts of suicide. Depression, not surprisingly, is one of the most common factors associated with physician suicide. 13.8% of physicians with symptoms of depression reported suicidal ideation. Physicians die by suicide at twice the rate of the general population and have one of the highest rates of suicide of any profession. For male physicians, the rate is up to 40% higher than the general population. For female physicians, it's up to 130% higher than the general population. 12.9% of male physicians and 21.4% of female physicians meet the diagnostic criteria for alcohol abuse or dependence. Prescription or illegal drug use is rare in physicians. Physicians who die by suicide were found in one study to be significantly less likely than the general population to have antidepressants present at the time of death. Physicians are also less likely to seek mental health services than the general population. Multiple contributing factors. As with anything, there's likely an alignment of root factors. What makes medical professionals good at what they do, they're highly educated, driven, motivated to care for others, and detail-oriented, is likely connected to their vulnerabilities to depression, addiction, and even suicide. Undermethylation. Specific vocations, often science or math-oriented, such as medicine, accounting, engineering, but also elite-level sports, will have a much higher incidence of undermethylation. The Walsh Research Institute found that undermethylation, which is a methylfolate imbalance, is the most common biochemical imbalance in depression. Remember that methylation is needed for the breakdown of histamine and detoxification. Those who are undermethylated often have low serotonin activity and thus more depression and anxiety. Because of the high histamine, many also have high activity at the NMDA receptor. This can translate to more addiction or obsessive-compulsive tendencies. The addiction could be to a substance such as alcohol, but it could also be to work, overfunctioning, basically doing too much. After all, who would sign up for 8 to 10 more years of education after college? Someone who is undermethylated might. So in the newsletter, I share an image that lists the traits of undermethylation. So to review those, perfectionism, being strong-willed, competitive, having a calm demeanor with high inner tension, being ritualistic, being prone to dietary inflexibility, and prone to depression, obsessive-compulsive tendencies, addictive tendencies, seasonal allergies, and high accomplishment or having high accomplishment in one's family. By itself, undermethylation can make physicians more susceptible to depression, addiction, and again, even suicide. Early family dynamics. In addition to biochemistry, some doctors may have been the gifted child, so to speak, not only in the traditional sense, but gifted in their ability to observe and tune into the feelings and expectations of their parents, at the expense of tuning into their own feelings. Such a child can grow into an adult who feels most secure when caring for others. The goal for anyone in a caregiving profession or role is to care for oneself, to be happier, healthier, and thus better able to care for others. While this gifted child dynamic doesn't apply to all physicians, individuals from this dynamic usually end up in caregiving vocations, which they are really good at. Some even become addicted to helping others. In the 12-step world, this is referred to as codependence. Not being tuned into one's needs and feelings in a highly demanding workplace is a setup for burnout, emotional exhaustion, ruminations, and numbing. Though we are all wired for connection, we ultimately all have to learn how to be that caregiver to ourselves, to notice when we are stressed or doing too much, to know when we are sad, scared, or angry, to know how to be present with ourselves and know how to reach out for help. Ideally, we learn this in our first 3 years. Many who haven't will learn it later when an illness, burnout, or crisis hits. Stress, worry, and ruminations. Undermethylation and a disconnect from feelings can increase one's likelihood of worry and ruminations. This type of anxiety is often masked by a calm demeanor. There's plenty for physicians to worry or even ruminate about. The well-being of their patients, the well-being of family members and friends who have come to rely on them for their care or advice. Having to tell someone that they have a terminal illness or having to tell someone their loved one has just died. They may worry or ruminate about mistakes made or fears about making mistakes. Physicians who believe they have made a major medical error in the past 3 months, a study showed, are 3 times more likely to have suicidal ideation. Aside from the potential harm to patients caused by medical errors, there can also be loss of confidence in medical decision-making and fears of getting sued, which is another worry or something physicians might ruminate about. Almost 1/3 of doctors are sued for malpractice. That they are taught to expect to be sued doesn't always remove the stress. With the onset of COVID, many doctors feared getting COVID, spreading it to their families, and or being unable to work. Some physicians worry about angry, entitled, or litigious patients. On top of all of this are the typical challenges in the workplace and in families. Burnout. Much of the work of physicians extends beyond the work of care for patients. After a typical workday, many do administrative work, chart, complete prior authorization requests, respond to messages, and do other paperwork related to their practice. Whether the long hours are due to systemic issues in the workplace, problems delegating, or an inability to ask for help, there can be little room for self-care and attention to other parts of their life. Study has shown that burnout alone is not directly associated with greater suicidal ideation in physicians. However, burnout combined with depression was associated with significantly increased odds of suicidal ideation. Numbing. There is only so much one can endure before the protective guardrails go up. Guardrails that have the potential to numb what are otherwise healthy and normal feelings. Remember, with undermethylation, the challenge can be lower neurotransmitter activity. Getting to that numb place isn't terribly hard. Many listening have probably been on the receiving end of an encounter with a doctor who seemed to lack empathy or a desire for understanding. To be compassionate with others, we have to first have compassion for ourselves. Self-reliance. It can be much easier for physicians and other medical professionals to solve someone else's problems than their own. Self-reliance, again, can come from biochemical drivers aligning with early experiences. To quote Deborah Williams, former chair of the Physician Well-Being Committee for the American College of Emergency Physicians, for physicians, there is an incredible stigma associated with seeking help for mental health and saying, "You're not okay." We are trained to be tough, resilient, superhuman, make no mistakes, So you don't show emotion, you don't cry, you don't ask for help. We've all fallen into that trap. The medical hierarchy can also reinforce self-reliance. That doctors are referred to as Dr. So-and-so creates what I see as an unhealthy dynamic with patients and other medical colleagues. Some will argue that such a title is professional and sets clear boundaries with patients. However, nurses, physical therapists, and other medical professionals are professional, have good boundaries, and do not have to be referred to with a title. Self-reliance is also reinforced by the risk to one's career and livelihood if they ask for help. To quote Dr. Margot Savoy, who is the Senior Vice President of Education with the American Academy of Family Physicians, as long as you can lose your career seeking mental health care, there will be physicians who will not seek care until they are forced by a crisis. If we want to support our physicians, we must begin by protecting them and allowing them safe spaces to receive care without retribution or punishment. Physician well-being. We can all benefit from having healthier medical practitioners practicing what they preach: good rest, exercise, sleep, less stress, and time connecting with themselves, their friends, and family. For solutions, I would love to see methylation and traits of undermethylation taught in medical school. How amazing it would be if physicians could take what they learned about themselves and be able to recognize and treat these vulnerabilities that are impacting many of their patients. It would be great to see attachment dynamics taught in medical schools. Again, we are all impacted by attachment dynamics. The better we can see how they play out in our work and relationships, the better we can care for ourselves and others. It would be great to see a flattening of hierarchies so physicians can enjoy what many other medical professionals have, namely peer support. It would be great to see peer groups where physicians can discuss their professional challenges with others. There is so much to be gained from being heard and seen, having one's feelings normalized, providing that for others, and learning how others are making changes in their work that support their well-being. It would also be great to see a culture of medicine that moves from silence to awareness, from shame and perfectionism to a recognition that doctors are humans who feel, have health issues, and make mistakes. A culture that moves from self-reliance to seeking peer support or, when needed, professional support. A culture that moves from burnout to professional satisfaction, from numbing to compassion for self and others. Lastly, it would be great to see licensure and credentialing applications that do a peer support group for about 8 to 10 people. We both recognize a need for a space where functional medicine practitioners can discuss, problem solve, inspire, and support each other in the professional and personal challenges of treating complex patients. Many of you will know who Dr. Neil Nathan is. If you don't, I would describe him as the leading expert in complex chronic illness. He's mentored many doctors around the country, including myself, and he is the author of Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivity, and Chronic Environmental Illness, which is a bestseller. So if you're interested, please reach out to me through my website at CourtneySnyderMD.com, where you can also sign up to receive these newsletters in your mailbox each week, and where I have information about my non-patient phone consultations. I look forward to connecting with you in a future episode. Until then, take care. Bye-bye.